the laundry room at Royal Blackburn Hospital. Not a part of the NHS that many of us think about, but staff here do vital work to keep the hospital functioning. 100,000 pieces of washing are dealt with here each week. So if this team is hit by flu, it can really throw a spanner in the works.
So you're okay to go ahead?
Yeah, that's fine.
Right.
That's why Becky and her colleagues are all encouraged to have the flu jab,
And lovely.
with nurses coming to them to make it even easier.
Thank you very much.
Last year I got flu really bad, so I definitely advise to get it done.
It's not nice, is it, when you get flu?
No, I couldn't get out of bed.
Last winter was the worst flu season in a decade, and sickness among staff only added to the pressure on the NHS. In England, just 64% of health workers took up the offer of a free flu vaccination.
Which arm do you want?
Yeah, left, please.
Left arm, yeah.
This year, all frontline staff are expected to have the flu jab.
Excuse me, lads. Hello. We're doing the flu injection today. Have you had yours?
It's not compulsory, but those who don't will be asked to explain the reason.
The flu jab for me is the absolute most important thing we can do in the NHS. What it does is it means that we're not only looking after the staff, we're looking after the families, we're looking after the patients that we serve, and we're also hoping to prevent hospital admissions at the front door.
The idea behind encouraging every single member of staff in the NHS to have a flu jab is to shore up the health service ahead of what could be a pretty tough winter by reducing sickness rates. Now, as that happens here at the Royal Blackburn, they have a pretty good record when it comes to encouraging staff to have the jab. More than 90% are expected to do so. But across the country, it is a very different picture.
Vaccinating staff at a single hospital is one thing. But what if your teams work across thousands of square miles and are always on the road? Last year, the East of England Ambulance Service struggled to reach even half of their workers. So this year, there are more clinics in more places to try and encourage crews to get vaccinated.
Healthcare professionals not getting immunised can increase the risk of our patients getting the flu. So absolutely one of the things we want our staff to consider is the impact on their vulnerable patients, especially if they choose not to have the flu jab.
Look over your left arm.
Some people simply can't get vaccinated. They might have an allergy, for example. But NHS bosses are urging those who can, especially healthcare workers, to get a jab, protecting themselves and their patients. Dominic Hughes, BBC News.